Hello, and welcome to the Millennial Nutritionist Podcast. I'm Isla Garcia, master's degree of nutrition science and registered dietitian, and I'm going to make weight loss realistic, sustainable, and uncomplicated for your busy lifestyle. On this podcast, me and my team of registered dietitians will decipher the latest nutrition research, dissect fad diets, and discuss social media trends for you so you can feel confident knowing what to eat to achieve your health goals. Research suggests that most weight loss programs aren't successful, but my experience has taught me that this is not because the participants aren't committed. It's because those diets are designed by non-nutrition professionals and center around severe restrictions. We are here to provide the facts about the science of weight loss so you can have the success you want and continue living your best life. Welcome back to the Millennial Nutritionist Podcast. My name is Isla, your founder, CEO, and host of our podcast. Overall, this year, we're focusing more on overall health and how losing weight and eating better improves your health. These topics aren't talked about often because they happen over a long period of time and don't have a marketable quick fix. I'm lucky to have so many friends that work in the medical field that can speak to what happens if you don't take care of yourself. And so today we're joined by my best friend, Vi Nguyen. I met Vi when we were in grad school for nutrition, but then she left me for PA school. But now she's an orthopedic PA who's going to talk to us about joint pain, what causes the need for knee and hip replacements, and what we can do to prevent the need for them. So thank you so much for joining us today, Vi.
Of course.
Well, I normally always ask our guests what kind of foods you're loving lately. And so Vi and I both went to grad school, or you went for what, even a year of a little bit of nutrition grad
I don't
school?
know.
Is
I
that
think
right?
it was, just about a year.
Yeah.
Mhm.
So you do have like a foundation nutrition a little bit and a love for food. So I wanted to see
Yes.
what you have been loving recently.
Recently, I've been trying to make more. So I'm Vietnamese, so I've been trying to make more like home style Vietnamese foods because, like, I feel like as as us in the millennials, you start thinking about like if you're gonna have kids and what are my kids gonna eat or what languages are my kids gonna learn and that kind of thing. So I've been trying to do more Vietnamese like home food, not like your typical. Everyone thinks of pho when they think
Yeah.
of Vietnamese food, right? So just like stuff, you have like rice with soup or whatever side dish. And then also I've been trying to do the same with Korean food too. So just like not Korean barbecue, but like the side dishes and all of that stuff. Hmm.
What are some of the examples of the side dishes?
Um, well, everyone probably knows that one that went viral, like the cucumber one, like the spicy cucumber one. That went viral on TikTok recently.
Oh, okay.
It's like a spicy cucumber side, and it's just like sliced cucumbers with sesame oil and like Korean red pepper flakes and stuff like that. So a lot of the nice thing about Korean side dishes is that almost all of it's like vegetable based, and it's very very vegetarian friendly. So if my kid doesn't like vegetables, then I don't know. I don't know what they're gonna do.
And then what about Vietnamese side dishes, or have you not ventured into that?
I've done a lot more soups because usually, like when I was growing up, we did like a rice, like a meat, and a vegetable and a soup. Because recently I was on TikTok and then this girl said, "Oh, I'm gonna come with me to make this Vietnamese soup." And it's funny because when I was growing up, I just thought it was this weird random soup that my parents made because we grow the vegetable in the backyard.
Yeah.
But now that I'm getting older, I'm like, oh, people like eat this at home with their families and stuff. So it's kind of nice to see just like home style meals that's not pho or like Korean barbecue.
Yeah, cool. Do you eat soup like in the summer too? That's my problem. I feel like I always like soup
Oh,
when it's warmer out and struggle, but I feel like I just need to get over that.
it was recently cold, like literally like 4 days ago, I feel like,
Oh,
but now I probably won't eat soup for a really long time. But my grandma, she has soup like every single day.
is it like soup? Like, is it just like vegetables and broth, or what is in
Yeah,
it?
pretty much. It's like the broth is made with either like a shrimp or a pork or something like that. And then there's like a squash or there's one that I just made the other day that's actually just spinach and shrimp. It feels
Oh,
very clean.
yeah. I was, I love like Blue Zone stuff, right? I think, yeah, we talked about it, or like people that like live forever. Maybe you don't know this. I talk about it
Wait,
like every podcast episode.
wait, what is it?
Oh, so there's like the study of these people they call blue zones. So like these areas of the world where people live the longest, like for a whole population.
Oh,
Um,
yes, you have told me about
and
that.
most of them do eat these like very simple soups, like you're kind of saying,
Mhm.
because they say how, yeah, because there's produce, it's what they have available. It keeps it really simple. They're not stressed out
Yeah.
about making it. So that's what that kind of reminds me of. The thing that I have been, I guess, like loving recently is just like water. I feel like I just want to remind everybody to drink their water. I was trying to think because I do so many of these, it's like difficult for me to like think of new ones. But I think recently I've been like drinking more water in the morning, and I always just forget like how much better that makes me feel, as opposed to being like, oh my gosh, I like need another coffee, or like I'm so hungry for
That's
breakfast.
true.
And
I
just
think
drinking.
everyone is guilty of not drinking enough water. Oh wait, actually another thing, this is
Uh-huh.
random, but I've also been making chia pudding. I forgot how like easy and just like just make it there and then just forget about it. And then in the morning it's like this big blooming thing. So
Yes.
I've been recently obsessed with it. Also because I've been putting protein powder in it. I discovered this, not discovered, but I saw this protein powder it's called the boba protein, or the boba tea protein powder. So it's similar to like boba tea flavors. There's like a taro milk, a classic milk, like honeydew, and matcha. So far, I've only tried the matcha and the taro, but so I've been mixing it with like coconut milk and then putting chia seeds in it. So it's because sometimes like chia seeds don't keep me full enough. So then
Yeah.
I started putting that in there. But yeah,
Where did
that's how
you find that?
on the internet.
Yeah, because that is really
I
cool.
was very easily influenced because
Oh,
you can also buy it with boba, like
oh.
the boba balls. Yeah.
Yeah, that's what I was gonna say too. Whenever you were talking about what you're gonna make your kids, I've been like such a food rat. I've just pretty much been eating like hummus and celery and like chia pudding every day for dinner. I'm like, I wonder if my kids are gonna eat this or if I need to get it together.
The
Like,
funny thing is that we don't have kids. It's just that
that's
we
true.
it's just
I just think
thinking
about it.
about, what they might do. I don't know.
Yeah. Gosh, scary. Well, today's article. So I always have an article to kind of like warm us up. And it was kind of difficult to find something about surgery on your hip or knee, but I found a celebrity who recently had one, a pretty big one, Oprah. So this is an article from Prevention Magazine, maybe, or just prevention.com. And the title is Oprah Winfrey reveals she underwent double knee surgery. I couldn't lift my leg. And I don't know if she like purposely kept it a secret, but what the article was kind of talking about is she had surgery on both knees, right? In 2021. It didn't really say anything until 2022. And then she's just kind of been reflecting on how grateful she is for her limbs because she had, I don't know if it was a difficult recovery or just recovery in
Mhm.
general is just like difficult.
Right.
But this kind of like just made me think that it's so hard to be grateful and aware of like your body's basic functions until it's taken away.
Right.
And so that's why I've recently kind of been big on like affirmations and being woo woo about like how grateful I am for different things in my body. But what kind of came to your mind when you first looked at this article?
First, I just love when famous people make these problems just come to light, because a lot of people don't really think about it until it happens to them. And then
Mhm.
so it's just really nice to see a celebrity or somebody that you admire go through the same problem as you. Do you know if she did it at the same time?
No, I think it was a couple months apart. I just
Yeah.
read. Yeah. Is that normal?
Yeah, that's normal. A lot of people like they'll do it and they either wait anywhere between like, I don't know, as early as like 6 weeks to 3 months. It just depends on your, logistical reasons. Are you going to have your husband or your wife at home to help you? Or your kids going
Mm,
to be home to help you? That kind of thing. So it makes sense that she just did it all in 1 year. So because once you do it, like, let's say that you did it this month, you really don't want to like, if you need both, and then you think, do I really want to do this again in like 3 years, or should I just do it all now?
oh,
So especially with somebody like Oprah, she probably didn't want to take like that hiatus from her career for like twice.
mm.
But it is a very like frustrating time. So I can see why she didn't. It can be. It's not like every, recovery, but recovery is not easy or anything. So she probably just wanted to just get it all over with.
Why wouldn't you just do it like both at the same time?
It really just depends on the patient and
Mm.
how, I hate to say like how much you trust them, because it's hard to do two, without having one good leg to stand on, basically.
Oh, okay.
I mean,
That
but you
makes sense.
can. There are people who do it. I have not personally seen it myself, but I do know that people do it.
Okay.
Yeah, and it's a lot of therapy. Therapy for one leg is one thing, and then therapy for both legs at the same time is probably a lot. So I have no idea.
Oh, I guess that's true because you probably need to like limp around on it. If you're in physical therapy, I guess it'd be hard to do it if you couldn't have any like thing to hang on to.
Yeah, yeah.
We're highlighting a lot of protein information for you for the month of April, so I wanted to include an ad that can make protein intake easier for you. I'm talking about Kevin's Natural Foods. I'm really excited about this ad because it's a product that I already recommend to clients anyway, I reached out to see if we could get a discount code for you and an affiliate code for me, and they were all on board. So here we go. We're all about whole foods at The Millennial Nutritionist, as in food in their most natural form, and Kevin's Natural Foods really fit that criteria. They offer pasta meal kits, heat and eat sides like mashed cauliflower, and what I normally recommend to clients, they're refrigerated chicken entrees like Thai coconut and Korean barbecue chicken. These are great for weight loss because they are an easy protein source that you could buy from the store and take home and just heat up. I know that a lot of you struggle with having enough time to make those important high protein meals, so check out Kevin's Natural Foods to solve that problem. If you come home at the end of the day and you just really don't want to cook something from scratch, this could be a really easy thing to just pull out of the fridge, add a vegetable and maybe a whole grain to it, and that is good enough for your meal. Enjoy the rest of your evening and go to bed. You can find Kevin's Natural Foods at a lot of grocery stores, Whole Foods being one of them, but if you order online and use the code TMN at checkout, you'll receive 10% off your first purchase. Transitioning into our kind of like meat of our talk today, can you give a little intro on you? Like, what do you do? What's your job? Like, why should we trust you in this interview?
I don't know if I can answer that, but okay. So my name is Vi. I'm an orthopedic surgery physician assistant. So my job role, I work in clinic with my supervising physician, who's an orthopedic surgeon specializing in hip and knee replacements. Typically, we focus on hip and knee replacements, but it doesn't mean we don't see other things. Like now I have paid more attention to, especially after you invited me to do this, I have paid more attention to specific problems that I see in millennials.
Okay.
But yeah, so it's not always just hip and knee replacements. We sometimes will see, ACL injuries like meniscus tears, things like that. So
Because some people might not even know what PA is that I feel like aren't like in the medical world. Can you kind
oh
of
yeah,
describe what that is too? I didn't put that in here, but maybe like what did
yeah,
you have to
yeah.
go to school for and what does that mean you do?
Yeah, so typically the PA curriculum, you have to go to undergrad first. So you do like a bachelor's in, some kind of science or something to cover your prerequisites. And then you go to PA school, which is typically 2 years long. After that, as a PA, you function what they call as a mid-level. You can see your own patients, you can prescribe, make a plan. And it just really depends on what specialty you go to and the specific doctor that you work for, what they like for you to do or what they want you to limit yourself. It just depends on how much autonomy you get. But you can see patients, diagnose them, and treat them. It just depends on how much, depending on where you're at.
And then you help with the surgeries directly, or what are you
Mhm.
standing there?
So for us, we do 3 days of clinic and then 1 or 2 days of surgery. So we most often see hip and knee replacements, but we also do something called arthroscopies where we put a camera into the knee and then see if this is typically what younger people will do. It's called an arthroscopy where we'll take a camera into the knee. We don't do it just for fun. I mean, we like have seen we see a problem or something on the MRI, and then we'll maybe do something with their meniscus, that kind of thing.
Can you tell us what is arthritis so we can have a starting off point? Like what causes it? What about like do previous injuries trigger it? Are there differences between like knee and hip arthritis? Can you give us the lowdown?
I think it's really important to establish what osteoarthritis is because a lot of people get confused about arthritis, like when they just say arthritis, because
Mhm.
rheumatoid arthritis is a totally different thing.
Okay.
So osteoarthritis is basically a problem with your cartilage. And so cartilage kind of covers the end of your joints to help it, bend smoothly. And so sometimes over time, you kind of just get this degenerative loss of the cartilage. So with that loss, you kind of get that shearing, rubbing, and that's when you start getting pain. And when you have that loss, you have like a response from the loss. So you might have like swelling in the joint, pain, just things like that. And so injuries can definitely cause it. Like now I'm starting to pay more attention to, like people who have, used to play basketball, used to play track or run track or play football, those kind of things. Like right now, I feel like millennials are kind of noticing like, oh, I'm starting to have knee pain or like, oh, these little small things. Yeah. So anytime you have an injury, it just, it increases the risk of like having instability. And then just that sheer force of just like damaging the cartilage. So cartilage is like gold for your joints, but not to
What
scare people. You're not gonna, you'll be okay.
Yeah, what do you mean like injury, like anything? Like what specific sports injury would trigger it?
So like an ACL injury, for
Mhm.
example, Like, so the ACL is right in the front of your knee, and so a lot of people will kind of injure it with like football,
Mhm.
basketball, those kind of things. Anytime you have, an ACL injury, you will increase the risk of having osteoarthritis later. It doesn't necessarily for sure mean that you'll have it, but it does increase the risk of having osteoarthritis, whether or not you fix it or not. Fixing it would be better than leaving it alone, though.
And then I think this was a specific audience question, like, are there any foods to prevent arthritis? What do you think about that?
Osteoarthritis is kind of hard just because it's caused by so many different things. So there's not really a specific food that you can have. Like you can get arthritis from just like, getting older and just what they call wear and tear of your joint. I mean, you walk on your knees and your hips every day. So eventually you do get some damage and stuff. But a lot of people that I've talked to, just like anecdotally, like the patients, they have relief, but once you have like a clinical, like on X-ray, you have some arthritic changes, you can't reverse it. So people always ask me like, am I going to get arthritis? Is it going to get worse? I always tell them it's not going to get better. So it can't reverse, but I mean, you can do things to kind of just help you feel better, basically. But yeah, as far as foods, I don't feel like there's anything that can prevent it, but a lot of people tell me that they have foods that make them feel better.
Oh, like what?
I recently had a lady come in and told me that she's been drinking turmeric every day, and she said that her knee feels a lot better. And so I
Okay.
was like, and then she said, "I'll just call you guys if I need you." So I haven't seen her in a really long time.
Well, we love conservative measures, so
Yeah.
that's great.
A lot of people have asked me about collagen. I know
Mm,
you wrote
yeah.
that somewhere too. We don't do anything with collagen in the office or anything like that, but some people have relief and
Is it, like, manufactured in the head? Like, if you don't feel it, like, is it a reason to still treat it? Like, if somebody's is taking turmeric and they still feel better, is there still a reason you'd be like, "No, you still have to, like, fix this," or would you just be like, "Okay, if you don't feel pain, that's fine?"
yeah, yeah, that's how I feel. I always tell people like the beauty about hip and knee replacement is that it's up to you. I mean, if it hurts then and you want to fix it, then we can. If it doesn't hurt, then just leave it alone.
Okay, so you're saying there's not, like, a specific food somebody should, like, add in that you would always recommend to somebody to, like,
No,
fix
I'm
pain?
yeah. So if you drink it and it makes you feel better, go for it.
Yeah, if it makes you feel better, I'm not gonna take it away, but if it's not unnecessary and it's expensive, no need to do it.
There's something called hip avascular necrosis.
Mhm.
Um, and basically the head, like I wish there was a picture of anatomy. So with hip avascular necrosis, there's something that you lose the blood flow of just the head part of your femur. And so that is something that you should replace your hip for. How we were talking about earlier, that osteoarthritis is really just, I mean, if you have pain and you want to have a hip or knee replacement, then you can. Something like hip avascular necrosis, you kind of lose the blood flow to that part of your bone. So you should have it replaced. So it's not as elective as like, I have pain, I want to fix it. I don't have pain, I don't want to fix it. So this is something that does actually affect young people. And it affects young people like from ages 30 to 50, basically.
This is like a question that just popped in my head that I probably should have asked a little bit ago, but does that mean that all pain in your joints mean that you have osteoarthritis? Just because I do have a lot of clients that say they want to lose weight because they have pain, does that mean that they should think that they have osteoarthritis or no?
No, definitely not. Just because you have pain in your joints doesn't necessarily mean that you have osteoarthritis. There's a lot of things in your joints that can cause you to have pain. Like, for instance, in your knee, you have what we call like kind of cushions in there, and it's called your meniscus. And so it sits between your two knee bones. So there's top knee bone, meniscus, and then other knee bone, like your lower leg bone.
Mhm.
So you can have pain from meniscus injuries. You can have pain just from just bumping your knee. So it's not necessarily that you have arthritis just because you have joint pain.
Okay, okay. We got a question from Instagram, about, like, is there a safe way to run to prevent joint pain? But maybe we can just broaden it out and, like, know if there's a safe way to exercise. Because even I've been thinking recently, I'm like, "Oh, maybe I'll start tennis," but then I keep thinking about you, and I'm like, "Oh, does that gonna cause me to have, like, osteoarthritis?" Like, what do you say for people who, yeah, like, are wanting to exercise, but also have good joint health for the long term?
So sometimes osteoarthritis, there are controllable risk factors and there are some that you can't control, right? Like things that cause osteoarthritis that you can't control is just like your body's anatomy. Like some anatomy increases the risk of having arthritis, so you can't control that, right?
Mm.
So it really is just up to you. If you feel pain when you do it, then don't do it. And if you feel fine, then just, you can exercise. If you want to wear a brace, if you want to wear a sleeve or those kind of things, you can. It really just depends on why you're having pain, what kind of brace or what kind of sleeve that you would choose. Like for
Okay.
instance, if you have knee swelling, a lot of people like to wear a sleeve to kind
Okay.
of help to compress it. Yeah.
So then if somebody is like training for a marathon now, you're saying that it's okay for kind of them to do that without having to worry about eventually getting osteoporosis because everybody develops it differently. Is that what you're saying?
Yeah, so there's so many reasons that you can get osteoarthritis that I would never tell anyone like don't run, don't do these things. Not unless like you have knee pain and you're like, what do I do? I don't want to have it anymore. Then I would just
Gotcha.
say that to do different kinds of exercises that don't hurt. Does
Okay.
that make
Okay.
sense?
Yeah,
Yeah.
yeah, no, that makes sense. It reminds me of like people are always asking me like, "Oh, if I eat this one thing, I'm gonna get diabetes. If I eat this one thing, I'm gonna get hypertension." It's like, well, if you already
Right.
have it, we need to not eat sodium. But eating a high sodium diet doesn't necessarily mean you're just gonna get it. Is what I'm
Yeah,
getting.
exactly. So
Yeah.
it's kind of just like it's very person to person. It really just depends.
We got another question asking, should I use knee compression braces during weightlifting if knee pain occurs? What do you have to say about this?
The knee pain, that again, kind of what I was just saying, that it really just depends on why you're having the knee pain. I mean, it doesn't hurt to wear the braces or anything, but it definitely helps to figure out why you're having it. So, go to your doctor or your orthopedic specialist to see what's going on in your knee to help you kind of better figure out what brace works better for you.
So again, it just kind of comes down to like needing to work with a provider to figure out like what's going to work best for you.
Yeah, yeah.
Okay.
But
Um,
again, it's not like it'll be bad for you or anything. It just, to figure out what the problem is first to see what brace or what orthotic helps you better.
we got a random question about joint pain during your period. Have you ever been asked this before? Like, do you have anything to kind of say? Somebody asked, is joint pain during your period normal? What do you have to say about this?
That is so funny. Actually, no one's ever asked me that. I think just because the typical patients that come in are usually like 50, 60, 70, 80, so they don't really
Oh,
have that. But I don't really know. I mean, I guess as a woman, I just feel like pain during your period is just normal.
yeah.
So I don't know.
Yeah.
I've
I
never
mean,
had that personally, so I don't know.
I haven't heard about this either, really. I mean, like I said, yeah, I feel like everything hurts when I'm on my period, and I always like hate being a woman during that time of the month. But yeah, maybe it's a question for somebody in a different specialty. This was another question. Can certain jobs that like overuse joints cause long-term joint damage?
I think so anyway. I tried to look it up just like research wise, but basically jobs that just have a lot of high impact on your knee. What I've seen, like anecdotally in my practice, is just that people who have very heavy labor jobs, people in construction,
Mhm.
tiling, roofing, those kind of people who are like crawling a lot on their knees. I've noticed that they have a lot. I mean, I don't know if it's just the nature of like, all the friction and just all the pressure that they put on their knees.
Let's move on to kind of like how do we treat arthritis? So let's say like for some reason, like maybe somebody is listening as a parent who has it, or maybe they have osteoarthritis. What about supplements for joints in general? Are there any that you recommend? Do you not recommend them? What about that?
Mhm. So I was looking into it actually, and I feel like a lot of supplements are it's kinda like the bracing, like, if it helps you and it helps you to feel better, then you should, but no supplements have really been shown to have any evidence of stopping the progression or slowing progression of osteoarthritis, again, because there's so many reasons why someone gets arthritis,
Mhm.
but it's not like taking vitamin D or fish oil or any of those things are bad for you, it's just it's not necessarily gonna stop arthritis, but in general, like, vitamin D is good for bone health, and there's not that much evidence on it making people feel better, but it's not like vitamin D is bad. Fish oil is very similar to where there's not a lot of evidence of it showing any stopping of osteoarthritis, but some people say it helps them feel better.
Oh, okay. So again, it like not is not going to change or decrease like the progression of it, but it can just like maybe make you feel a little bit better.
Yeah.
Okay.
Kind
Yeah,
of
I feel
like
like
the lady I told you about that just likes to take the turmeric because she feels great with it. So go for it.
yeah, I feel like there's a lot with fish oil. I feel like there's a lot that comes out with like anti-inflammatory fats and how it can like help with stuff like that. So that's really interesting. When is it time to like get surgery versus like treating it more conservatively? And like what does that even mean? Like a brace? Can you talk about that?
With arthritis, again, the beauty of it is just how do you feel? I always tell people like, it's no one's decision but yours. No one knows how much pain you're in except for you. So if you feel like sometimes on an x-ray, the arthritis looks horrible. I mean, like it just looks really bad. And the patient's like, I feel okay. It's not that bad. Well, then that's okay. You don't have to have it. And then sometimes patients have some arthritis and it hurts them a lot. So it really just depends on how you feel. We obviously wouldn't just replace your knee if you have no arthritis at all, but just depending on, circumstances that a lot of people don't think about are like, is anyone going to be home to help me? Who am I going to have transportation to physical therapy? The time of the year, do I have time off of work? A lot of people have to arrange it with January at the beginning of the year, they have new insurance, or December when they have met their deductibles. There's so many things that people think about, like just in their home or logistically, that they have to think of. But as far as clinically, it really just depends on how you feel and if you're ready to do it. If you're like, I don't think I want to do it, then don't do it, because it's a lot of work with physical therapy. Like I always tell people, we have the easy part where we just replace your knee, but then afterwards, like you have a lot of physical therapy to do, and it made me think of the Oprah article. She probably just spent a lot of time just like going to therapy, and it can be frustrating because it's like right after surgery your knee's kind of swollen and it hurts, and you don't want to do therapy, but you have to do the therapy.
What happens
So
if you don't?
then if you don't do therapy, then you get really stiff and your knee like doesn't bend back the way that it used to, basically.
What does a knee replacement mean? Like, what are you even replacing?
So can we pull up I wonder if we can pull up a picture or something.
Yeah.
Let me see. Okay, so if you look on the left picture is what they're depicting as a normal knee. The one in the middle is arthritic knee. And then, so with that picture, you can kind of see, earlier when I was talking about, you have a little like cartilage loss, that kind of thing. And in the middle picture, you can kind of see on the sides and in the middle of the knee, like right where the two bones meet, you can see that redness, that change where they have a lot of friction, and you kind of get the response of having that cartilage loss. And so when you replace a knee, you cut out that part, and it's kind of like you put a little stencil. It's kind of like a stencil. You cut off that part of that top bone, and then you cut off a part of that bottom bone. And so it's metal, plastic, and metal. So you take out
Like this, like damaged bone area?
yeah.
Okay. And just replace it with like something that's going to move against each other a lot smoother.
Yeah, correct.
If you don't get a knee replacement, does anything happen to like to you, I guess, or like the rest of your body? Like it doesn't like go on to impact like other things?
Like holistically, does it affect anything
Yeah,
else?
I'm just thinking like if somebody like just never wanted to get one and they were in a lot of pain, it's totally fine.
Yeah, I mean, if they want to live like that,
Okay.
yeah. I mean, it'll just hurt a lot. But they will probably end up like not using it a lot, and then they get really stiff and stuff. They say that with a knee replacement, this famous quote that every surgeon uses is, the motion you have before surgery is the motion you have after surgery. So
Mm,
if your knee bends like this much, then that's what we want you or expect you to bend afterwards. If your knee bends all the way, then we want you to bend it all the way after.
oh, wow. So does that mean the earlier you get surgery, like the better your outcomes?
Yeah, so see, that's kind of why
Mm,
you got to think about when you choose it, because if you wait until your knee is really hard and really stiff, like how much motion are you going to get afterwards? And so there's a lot of things you have to think about, like realistically, like your living situation, or how much I mean, she's like 95, her knee really hurts, but
yeah. What's that going to
does it,
improve?
so it's like not worth it for someone like that, would put them at higher risk of having a big surgery.
And then are there ever times where you like just have to get surgery regardless?
Yeah, so actually so usually hip and knee replacements are pretty elective. Like if it hurts, change it. If it doesn't, don't. But there's something called hip avascular necrosis, not to scare people, but this does happen to young people. Like it presents, I think, between 35 to 50 or 30s to 50s. And it's something that can happen, there's a part of your femur, part of your hip joint that kind of loses blood, and that head part of it dies.
Mm,
So basically, in that, you would want to replace your hip. It's not something that like happens overnight or anything, but there are things that increase, there are known risk factors. Unfortunately, the most common cause is idiopathic, which is just a fancy word to say we don't know. But the other like identified causes are actually, some of them are nutrition related. So one of them is alcoholism. So they've noticed that people who have an increased, who are alcoholic have increased risk of having that, of the hip avascular necrosis. Something else is chronic steroid use. And so when we talk about steroid use, we're talking about oral steroids, like people who have like, like skin problems and stuff, chronic steroids. So not just like, you got sick and you got a round of steroids or something, but people who are on like steroids chronically. And injury too. So you can directly injure that part, and then, you can injure the vasculature, just the blood flow to the hip.
But how can weight affect like joint pain slash osteoarthritis?
Your weight affects your joints so much more than you think it does, just because, again, like we were talking about, you just really take for granted your hip and your knee health until you have problems with it.
Right.
For every 1 pound that you have, it's around 3 to 7 times weight on your knee. So it just depends on what kind of activity level or activity that you're doing. So let's say if you're walking up the stairs, if you're just walking, if you're running, those kind of things, your weight plays a big role in how much pressure you have on your knee every time. So I linked a reference there, but there are a lot of studies that go in there and specifically measure like jogging, incline, decline, stairs, walking, those kind of things, and how much weight you really put on your knee as you do those things.
So it's more like the combination of like the extra force plus like you being having to be active on your knee is what can cause osteoarthritis. Is that what you're saying? Or just pain?
Um, it can definitely increase your risk of having it, or just like so remember how we said that osteoarthritis is cartilage damage, right? So
Mhm.
anytime you have like increased force, all of those things, you can increase your risk of damaging your cartilage, or, having long-term effects from that, trauma every day to it.
Gotcha. Okay. And then of course this can be like difficult because if like you're overweight, like you're gonna probably be told to exercise, right? To lose weight. And then if it hurts so much, then you just can't. And it sounds like you kind of get stuck in
Yes,
a
I have so
cycle.
many people that are in this like vicious cycle where their knees hurt, so then it's hard to exercise because it's hard to exercise. It's, they're gaining weight, and now it's making their knees hurt more. And so it's just
Mm,
like they keep gaining weight, they keep having worsening knee pain, and it's awful for them.
what is the solution for a problem like that?
Oof. The solution I try to tell people is to do exercises that are low impact. So things that they're exercises that you're not going to have a lot of force on your knees. So low impact exercises would be any aerobic exercises like swimming and cycling, rowing, yoga, elliptical, walking, those kind of things.
Or do you find that when you kind of do recommend that, do people have success with that, or how does that end up working out?
It depends on the patient, really. Some people are really, really motivated by their knee pain. They're like, I just cannot deal with this anymore. It hurts so bad. Like, I'll try anything. And so I have had patients come in and they tell me, like, oh my gosh, I've lost 10 pounds and I feel so much better because, and, people get discouraged because they say, it's only 10 pounds, but really 10 pounds is like 30 to 70 pounds for your knee. So,
Yeah.
you know, so
Is
it's a
it
lot more on your knee than you think.
is it possible that somebody would be able to like lose weight and then not have to get surgery, or no, they're still gonna have to get it
Yeah,
anyway?
yeah. I mean, there was one patient I had recently that she had a lot of knee pain, and she wanted to lose a lot of weight to become a surgical candidate because she needed to lose weight, and she lost weight and she didn't have as much knee pain, so she decided to hold off. She was like, it doesn't hurt as much now.
Oh, good. Well, that's a happy story.
Oh, yeah. Most people though, they still have the knee pain, but it definitely improves. I had a lady today who got up and she actually came into the room, she took off her shoes and started dancing. And she was like, look, I lost 10 pounds, and she from dancing and stuff like that. So she had less knee pain than she usually does.
What is this picture that you have? Is that supposed to explain the surgery here?
So this is a 36-year-old female. She is a patient who, she came in with knee pain of her right knee, and she said she went to the beach, she twisted her knee, and she just had been having pain ever since. And this was like, no, we first saw her in July of 2022. We did the surgery in September, and these two pictures are 6 months apart. And you can see only 6 months later, if you look on the picture on the right, you can see that the bone is sitting right on top of the bone now. Yes, we did take the meniscus out, so it increases the risk of that happening, but that I felt like it was a rather fast progression, and her BMI is 56. So it probably doesn't help that, one, we took out the meniscus, but two, her BMI is 56. So she very quickly became what they call bone on bone arthritis.
Like, why is it that the weight exacerbates this? Is it just because, like, the sheer weight that, like, your leg is, like, making it go down? Like, is that all it
Yeah,
is?
yeah. So yeah, one, we took out the meniscus, but yes, the
Mhm.
sheer weight of like she walks every day. I mean, she walks to at work and stands all day and those kind of things. So yeah, so you can see the physical difference of the arthritis that she developed in 6 weeks.
Wow, dang, in 6 weeks, that is
I mean,
crazy.
sorry, 6 months
Oh,
that she
6 months.
developed in 6 months.
Alright, what about anything else we should know in general? Anything with, like, surgery or anything like that?
In general, with arthritis, there are things that you can't control, but there are things that you can.
Okay,
So I feel like as a young person, as a millennial, you should focus on the things you can control, which is your weight and your muscle strength.
okay.
The reason why I say muscle strength is because your muscles help to stabilize your joints. And earlier I talked about how having like that instability or any kind of like shear force or friction on your joints increases your risk of having osteoarthritis or just injuries, those kind of things. So if you do the modifiable things, which is, your weight and muscle strength, that I think will help you a lot in the future with your knee health or your joint health.
I didn't even think about that, like, yeah, of course, that, like, muscles help for so many reasons, but I didn't think about so they're, like, helping you as well to, like, what, protect it and just, like, hold everything together, or what do you mean
Yeah,
it
to
actually
like just
does?
stabilize things. Yeah.
Okay, gotcha,
Because like
gotcha.
if you have weakness in one muscle and a weakness in another, like this one pulls a little bit more than this one, that kind of thing.
And then, another one just comes down to losing weight, like you said, that other all your other patients that talked about how they felt better after they were able to lose weight and they didn't need the surgery. So
Mhm.
what we can kinda work on now is just making sure that we are at a healthy weight to make sure that we don't have joint pain and then eventually kinda get into this cascade of eventually needing surgery. Is that right?
Mhm. Yeah.
And then again, like, just like what kind of exercises are good to kind of work on now? Maybe if somebody has joint pain, like what can they do so that they can lose weight to not have it anymore?
I wouldn't necessarily say that like losing weight reverses any kind of injury or
Mhm,
reverses anything, but losing weight does help just symptomatically, right? So
mhm,
you can't really reverse anything that's already happened, but losing weight can help you just to feel better. And a lot of exercises that are low impact, so stuff that you're not like putting all this force on your hips and knees and stuff. So which would be swimming, cycling, rowing, elliptical, and even just walking.
mhm. Well, good. Those are
Because
the things that
some people have, pain people have pain with running,
right.
just with that impact.
Well, good. Those are things that we all normally recommend anyway. So make sure to keep your muscles strong, do your strength training, eat your protein, and maintain that current body weight. Well, thank you so much for joining us today, V. I feel like that was really helpful to understand because I think we're all starting to get to the age where these our joints are starting to hurt. We might not know parents that are having these things. We don't want these things to happen as well.
Mhm.
But I just want to plug our email newsletter. So make sure to sign up so you don't miss anything. We have tons of blogs that come out every week, YouTube videos. If you like this content, make sure to subscribe there so you can kind of see everything else. But thank you so much for joining us. Thank you so much for listening to the Millennial Nutritionist Podcast. For daily weight loss tips and nutrition information, you can find us on Instagram at the.millennial.nutritionist and on TikTok at millennial.nutritionist. If you find this information helpful, please subscribe to the podcast and share it with a friend who needs encouragement on their health journey. See you in the next episode.